"17 years ago, my neighbor Marcia invited me to an unusual birthday party where 25 women pooled what we would have spent dining out, and instead we donated it to women and girls living in the most marginalized corners of the world. I was pulled in that night by 3 magnetic forces that started my addiction to dining for women. Finding a way to get money into the hands of the women I'd met on a trip to Tanzania, seeing how collective action and collective giving gives an individual the power to be able to change the world. And 3, learning how smart it is to invest in the futures of women and girls if we want to build a sustainable world of peace. Our idea spread like wildfire, and soon we were the largest giving circle in the world with 500 chapters spread throughout the United States. Together, we have amassed $8 million, changing the lives of almost 2 million women and girls, their families, and their communities. And for all of us, we should say, well done. In our early years, we were one of a handful of organizations working to open doors of equal opportunity. Back then, we focused on women and girls as the best way to end extreme poverty. While this is still true, our focus has evolved beyond economic empowerment to ending everything holding women back: nutrition and health, gender-based violence, human trafficking, access to technology, and climate-related challenges. Over the last decade, there has been explosive growth in the movement to advance global gender equality. We are now one of thousands of organizations making this happen. With all this change, the board realized that our early mission and vision statements needed to catch up to the sophisticated, powerful, high-impact organization that we've become. In the last year, we've been gathering your feedback, and I am super excited to be sharing what you all told us. First, I want to tell you what we heard loud and clear about what you love and things that will never ever change. Our chapter and collective giving model, our focus on women and girls globally, funding grassroots and women-led featured grants, and being a democratized community where our doors are open to everyone. We also heard what we needed to change, that our guiding star has evolved to achieving global gender equality, and that it's time to create statements that reflect our work as one collaborative community, learning and working together in true partnership. And now, with COVID hitting women harder and threatening to undo the years of progress we've made, Dining for Women can and must do more. And we begin with clarity of our mission and our vision. I want to thank you all for inviting Dining for Women into your homes, into your lives, and into your virtual spaces. I know it's personal. The cause is personal to all of us. Together, we are changing the world because we know that when one woman rises, we all rise. And as always, we do it one by one.
Gender equality is urgently needed to make any progress towards the UN Sustainable Development Goals. So getting women the right to equal education, to equal health care, to equal job opportunities, and control over their own bodies and reproductive rights is critical to any development in poverty alleviation, climate improvements, or any kind of progress we want to make. So I think it's so important that women's rights be understood as human rights. Thank you.
As Barb mentioned, it's time for the world to see Dining for Women as the effective, powerful community we are today. That's why I'm so excited to share with you our new strategic plan that focuses on achieving global gender equality, increasing our impact on women and girls around the world, and building a highly engaged and inclusive global community. Achieving global gender equality has been our guiding star all along. With this new strategic plan, we are stating boldly who we are and why we exist. Dining for Women champions global gender equality because women's rights are human rights. When women and girls are given the opportunity to reach their potential, they change their communities for the better, and the world is healthier, safer, more peaceful, inclusive, and economically just for everyone. While global gender equality has been our focus all along, we've often talked about what we do, but not why we do it. So we've updated our mission and vision statements to put our purpose front and center. Our new mission statement is, Dining for Women cultivates the collective power of community to achieve global gender equality. This mission statement focuses on the power and impact of our Dining for Women community when we all act together. It clearly communicates why we exist and that global gender equality is our guiding star. Our new vision statement is, Dining for Women envisions a world where every person has the same opportunities to thrive, regardless of their gender or where they live. So how do we get there? We will work through 3 core action areas: giving, learning, and community building. We will give together in our grant making. We will continue to fund projects that focus on women and girls. We will also be working with our grantees in new and innovative ways in which we truly partner with them on changing the way the world works for women and girls. Over the next 5 years, we aim to triple our dollars invested in grants. We will learn together and we will dig deeper into important issues. We want to learn about the innovative solutions that are happening around the world, and we have so much we can learn from each other across the miles. And we will build a diverse and inclusive culture and community together within DFW and with women and allies all around the world. Everything we're sharing reflects what we've heard from you, our members, in the past few years. You told us that you are motivated by our impact and you are eager to help even more with women and girls, and this strategic plan will do just that. I am so proud to be part of the Dining for Women family with each and every one of you, and I'm so excited for what we can achieve together as we fight for a future with global gender equality.
Para mí, la igualdad de género global implica que niñas, niños, hombres y mujeres deben recibir los mismos derechos, las mismas oportunidades y los mismos beneficios. Deben ser tratados con el mismo respeto en todos los aspectos de la vida, como la salud, educación, trabajo y salario. Y por qué no decir ejercer un cargo público. Desde allí se puede tomar en cuenta las necesidades y prioridades de las mujeres y hombres. De esta forma se logra una igualdad de género global.
A world with true gender equality will be different because women will have the freedom to move, to live, and to speak up without threats of violence and harassments. Practices like female genital cutting and child marriage will be a thing of the past. Women and girls will have equal access to education, economic opportunities, healthcare services, and basic human rights. Women will not have to prove or fight to show that they are worthy members of society.
The healthcare system in Haiti is broken, and tens of thousands of people die every year from preventable and treatable illnesses. Nearly 60% of people live below the poverty line of $2 per day, and the maternal and infant mortality rates are among the highest in the world. As decades of political and economic crises continue, Haiti remains the poorest nation in the Western Hemisphere. Government hospitals and clinics have insufficient resources to provide reliable care to a poor population, while well-intentioned but unsystematic volunteer and missionary clinics across the country create confusion in the health marketplace. These conditions present a grave danger to Haiti's poor, especially for expecting mothers. Approximately 1 of every 80 women in Haiti will die from childbirth and pregnancy-related causes. Childbirth is often left in the hands of the women themselves, due to limited healthcare access and limited health-seeking behaviors. Only 49% of women in Haiti give birth with a skilled attendant, and only 39% deliver in a health facility. In impoverished communities where C2C operates in Northern Haiti, women face multiple barriers to safe pregnancy and delivery, and babies are at risk for malnutrition and disease. Haiti also has a high rate of teen pregnancy, which intensifies risks for both girls and their children. Some 14% of Haitian adolescent girls ages 15 to 19 are already pregnant or have children. The average age at first sexual intercourse is 17 years old, and 56% of the women reported sexual debut before age 18. While it is well known that adolescent pregnancy is strongly linked to poverty, lack of education is also a strong determinant of early sexual initiation. C2C currently runs a maternal health program at 2 clinics that has been met with high demand, reaching vulnerable women with much-needed antenatal and newborn care. We have treated approximately 2,500 unique pregnant women and registered over 10,000 clinical visits. Our family planning and reproductive health services have also demonstrated a high need in our communities, with our number of family planning patients rising 5-fold in its first year. But without reliable sources for family planning and sexual and reproductive health information at schools or at health facilities, young girls and women, especially in the rural areas we serve, are at risk for early pregnancies. There is also a high reliance on traditional medicine and voodoo practice in some areas, and health-seeking behavior with regard to family planning is not a cultural norm. Ensuring that women have reliable control over their reproductive health is a human rights imperative and an urgent priority. However, we are not reaching most women until they become pregnant and seek our antenatal care. Girls younger than 18 make up 12 to 15% of our first prenatal visits, and our most frequent diagnoses across our clinic network are genital and urinary infections, including many STIs. We also know that sexual and reproductive health education is not part of the school curriculum in our region. C2C has created a new and innovative approach for community healthcare delivery in Haiti, a social enterprise model that delivers reliable, affordable, high-quality primary care through a network of clinics. C2C provides primary care, antenatal care, and family planning services across our clinics in the north of Haiti. We seek to provide culturally sensitive information and education in a comfortable community setting with trusted and knowledgeable C2C nurses to encourage the use of family planning at earlier ages. By launching a new sexual and reproductive health education program to reach young women who have not yet accessed our family planning or antenatal services, we provide them with the information and tools they need to prevent early, unwanted pregnancies and gain control of their reproductive health. To achieve this goal, we have developed a new curriculum on reproductive health information and options for girls ages 13 to 20, and pilot a 20-week sexual and reproductive health education after-school program with over 400 girls enrolled over a 12-month period. By piloting this program that will directly impact young girls and women and indirectly impact their families, C2C aims to improve knowledge, change attitudes, and increase use of family planning commodities and services among adolescent girls in Northern Haiti. Our long-term goal is to empower girls and young women to reduce teen pregnancies in our catchment area and limit the cycle of poverty we see among the families we serve. For too many expectant mothers in Haiti, pregnancy and childbirth are not always the joyful events they hope for. Educating girls and young women about sexual and reproductive health will result in higher levels of improvement in women's general health, increases in female labor force participation and earnings, and increased child health. Join us in building a bright future for women's health in Haiti.
In a valley surrounded by the Himalayas, there are thousands of women who struggle with unsafe living environments, lack of access to education, and little economic opportunity. Each woman has a different story. Most women were never given the opportunity to step into a formal classroom. Many women dropped out of school because of marriage. For women in circuit, opportunities to make a living and have a voice in their community is limited, almost non-existent. At Blink Now, our mission is to empower Nepal's children with a children's home for 40 and school for 400. Blink Now is providing opportunity for children to have a brighter, healthier, and happier future. After 7 years in operation, we knew we had to empower the caretakers of our children to create a stronger and more sustainable future. In late 2013, the Women's Center opened its doors, and in January 2014, because of a $40,000 grant from Dining for Women, we successfully piloted the center, instructing sewing and tailoring. The Kupila Valley Women's Center serves at-risk women in our community with life-changing vocational and empowerment trainings. We believe that investing in women creates healthier families, more prosperous communities, and more peaceful nations. The Women's Center offers something uniquely special, a safe place to learn, create, grow, and heal. Within our walls, friendships blossom, and women of all ages and backgrounds come together to support each other. When we talk to Women's Center trainees, we hear a story of abuse, deprivation, and loss. 94% have experienced domestic or gender-based violence. 97% have little to no knowledge of their legal rights. 32% have had no access to education. 51% were married before the age of 18. Behind each of these numbers is a vulnerable yet powerful woman. She may have been married at a young age and unable to go to school, but now she pursues an opportunity to learn. She may have endured an abusive childhood, but now she demands a better future. Our empowerment course covers topics including self-confidence, self-advocacy, health and wellness, women's rights, basic math, writing, and business skills. Each trainee has access to counseling services, including meditation, legal support, and trauma care. We open day-long empowerment workshops to the community to increase the reach of our impact. Over 250 women in Circuit have attended workshops on topics including family planning and reproductive health, women's rights, and entrepreneurships. We were overjoyed to hear Blink Now had been chosen as sustained grant recipients. Our Dining for Women partnership helped us to establish the Women's Center, and we were so grateful for your continued belief in our mission. With the Dining for Women Sustained Grant, the Kupila Valley Women's Center will be able to continue to grow and enhance job trainings and empowerment courses. Our goal is to enable women to find independence, and that takes long-term, loyal support like the Dining for Women grant to accomplish long-term sustainable change. We love seeing our graduates start their own businesses, whether it's new tailoring shop or vegetable stand in the market. Of recent graduates, 100% reported an increase in income. Our graduates demonstrate that education is the best way to break down social and economic barriers. When women are educated, the risk of exploitation is reduced, marriage and childbirth are delayed, and labor force is more productive. We provide the tools, but it is the strength of these amazing women that drives progress within our community. That is the true magic of the Kupila Valley Women's Center.